Hey y'all, it's your girl Tay. I'm here to talk to you guys about what surgery I received and all the questions people probably asking, like, Tay, what did you do? What did you do? What you do now? What you do now? I don't be doing too much, but I be doing enough. So the surgery that I received was a labiaplasty. What a labiaplasty is a surgical procedure of removing the labia minora, and that's the skin, the inner lips on the inside. Why I did that is because I was having discomfort down there, and the discomfort was to the point like I couldn't exercise without feeling it. Wearing certain like underwear, it was causing like problems, so I decided to address it. How did I get this procedure done? Did I pay for it out of my own pocket? Did I go through my insurance? I got this done through my insurance. I was covered. I just paid a copay. Everybody's different. If you are going for specifically appearance and just that's cosmetics, so that's when you go see actual surgical doctor that does cosmetic procedures, and it's still considered a labiaplasty, but that's going to be more for the appearance. And I went to the OBGYN surgical doctor, and that was addressed through my insurance. So that being said, there's two ways to go about this. If your insurance covers it, then hey. If your insurance doesn't cover it, then you're going to pay out of pocket and go through cosmetic. It's going to be a cosmetic procedure. If you are thinking about like scarring or anything like that, the scarring down there is not obvious because of your tissue and your anatomy down there is different than your actual skin, like on your face and your ears. It's a little different. So that skin, I don't see any scarring. I don't see any scarring. It's like where the skin was removed, where the sutures are placed, everything's fleshed and blended in. So I don't see anything that's different besides the reduction of this one side of my labia. I did both sides just to make sure that everything is going to be symmetrical and I don't have to go through this again. Okay? Because say if I was to get one side done and that's all nice and flush and even, and then the other side's not done, and then say I have an issue long down the road where it's like an overgrowth of skin, I have to go through this again. And I'm the type of person, I want to get it done and do it and get out the way. So that being said, I did this to both sides. I don't see any scarring. I don't have any keloiding. Everything is perfectly symmetrical and is healing properly and is flesh. With the sutures that were placed down there, they were dissolvable stitches. So I can't see anything besides like the little knot at the end of where the suture is. Pretty much like closing it and ending it. They're dissolvable. They're going to take time to pretty much dissolve. Dissolvable stitches, they are going to dissolve with your healing of your body, okay? That doesn't mean that, you know, it might not, one stitch might stay there and I have to go get it removed. It's common, but the thing is that they're supposed to dissolve on their own. So fingers crossed, everything dissolves on their own and I don't have to worry about, you know, going to the doctor and they pull it out or anything. My recovery time for it, it's my second week, so I'm still feeling sore. That first week was horrible. I'm not gonna lie to you. It was hard for me to walk. It was hard for me to really close my legs to sleep. So the first week is rough. So I was on a lot of pain medication, sleeping. I barely could eat, but I forced myself to eat and just to get well. Now going to the second week, you start to feel better. You start to feel like you can walk, but you still got to take it easy. So not lifting anything heavy. So pretty much after this procedure, it's going to take about 4 to 6 weeks to really recover and feel like you are able to do physical activities, and not meaning just sexual, exercising. I like to work out. So, you know, that's going to be a little downtime. So this is my second week, like I mentioned. So right now I still got about 4 weeks to go. But I will be doing a follow-up with a doctor within the next week and a half in regards of when I can start working out. So I would discuss that with them. So probably the next time I have this conversation or do another video, I can talk about when I started, you know, working out. Why to do this? To do a labiaplasty is only for certain people, discomfort, hygiene, and overgrowth of tissue down there. So that being said, a lot of people do this because discomfort wise, they notice, as far as, you know, when it comes to, say you have a baby and your anatomy change down there, hygiene, having extra skin down there, you are more like yeast infections and all that type of stuff. If it's for, say, discomfort reasons, or like genetics, genetically you can't change, you know, genetically you was born how you was born, and sometimes how the way you're born, there is extra something or a lack of something. So it can be genetics. This doesn't have to just be done because you had a baby. Okay, I don't have any kids. This is my only baby. He's my fur baby, and his name's Smokey. So yeah, and this doesn't have anything to do with sex necessarily either. So if you are thinking like, oh well, you know, if you're intimate, that can do, not necessarily. That's not gonna stretch out your labia minora or the inner lips. But yeah, so those are reasons why you would do this. As far as the downside of it, you have to express to your partner that you will not be able to be physical for 4 to 6 weeks. That's very important to discuss because you're still healing. If you plan to get this done and it's the summertime, you might want to reconsider, just due to the nature that you cannot be in pools, saunas, any type of form of water because of infection. So there's a lot to consider when you're doing this surgery. Prior to surgery day, I get contacted by the physician, like the nurses, in regards of what to do and what not to do prior to surgery. Didn't know how in-depth surgery was, or like, you know, how serious surgery is. It's a lot. It's a lot. So she tells me I can't take certain medications or like take vitamins. I need to stop all my vitamins and supplements a couple days prior. So I think it was about 4 days prior to surgery to stop all of my vitamins, especially vitamin C. It can like thin out your blood, from my understanding. Now we're on, or the day before, she told me the day before surgery, stop eating by 7 or 8 o'clock. My surgery was at 9 or 10 in the morning. Now let's go ahead and get to surgery day. And that morning I was like a little nervous. Anxiety's out the roof. I'm like, oh my gosh, I don't know how this is gonna feel afterwards. I don't know what's gonna look like afterwards. Like, you know, just a lot of emotions because, you know, like I'm doing something to help with my comfortability, but also it's nerve-wracking because this is my first surgery, and it's something I'm doing to change. It's changing something, so it's gonna look different. You know what I'm saying? It's gonna look different. So going in, I go to we get to the hospital. I go in, we go through insurance verification, all of that stuff. Now they take me to the back. When they take me to the back, when you go to the back, they're pretty much prepping you for surgery. So the anesthesiologist, they're gonna come in, nurses are gonna come in. They're gonna just talk to you about, you know, confirming what procedure you're getting done, go over like, you know, any type of allergies or any medications that you're on, or all of that type of stuff prior to surgery, just to make sure they don't give you anything, or, you know, also, you know, we're doing surgery, you probably got to say we can't do it because of this and this and this. So while I'm there, I walk in this room, and they're telling me I got to wipe my body down with surgical wipes. The surgical wipes were to help with, it's like an antiseptic, so it removes any bacteria off the skin. And with the antiseptic wipes, you wipe it from only on neck all the way down. You're not putting inside any private matters or origins or anything like that. Just mainly like your chest area, your abdominal wall, your legs, and your backside, where your body's gonna be touching like a surface, because they want to reduce the risk of an infection. So it's infection control. Now I'm putting on a gown to put on prior to surgery, and I'm putting on a hairnet. I'm in there, I'm waiting actually for the doctor to come in and say, we're about to get started. Now I'm getting IVs put into me. I'm getting I think a medication. I took a medication prior to surgery. I can't remember. And I got a nausea patch, anti-nausea patch on the back of my ear. I remember that. So the nausea patch was for, you know, when you get surgery, after you're gonna be a little nauseous and everything. So they're trying to pretty much relieve your discomfort, any type of nausea and like pain and all that type of stuff. So now we're in surgery, and I walk to the back. I sit on the table. I get on the table. They have me on the table. All the nurses. It's probably like a good 6 to 7 people. So when you're getting surgery, any surgery, there's a team on board. It's not just one person. Even though that one person's doing your procedure, there is like multiple hands on deck, multiple eyes observing the situation to make sure that it goes correctly. Everything goes good. Everything is a-okay. They have nurses in there. They have the doctor in there. They have the anesthesiologist in there. They're introducing themselves of, you know, everybody who's in the surgery room, who's in there and all that. So I'm like, okay, that feels good, because, you know, I want to know who these people are, you know, in here while I'm doing this procedure. Like, you know, it's nerve-wracking. So go through all that. They tell me exactly their names and, you know, what is their scope, you know, what's their licenses and stuff like that. So next thing you know, they confirmed what kind of procedure I was getting. I was out. Then I woke up and I was sitting down in a chair, just with my clothes on, not the bottoms. Of course, I had on, like, I'm gonna be honest, they were diapers. I had like a diaper on. So I'm like, oh my gosh, I feel pain, but the pain is like maybe 7, 8, but I was so drugged up to the point it was like you feel pain, but you don't feel it at the same time, because you're heavily sedated to the point like it's manageable. So you're like, I'm out of it. Like, it really doesn't even matter. And then the nurse is in there. She's like, I'm gonna help you put your, you know, clothes on. So this is another thing. When you get a labiaplasty done, I highly recommend to wear something comfortable. Do not go in there with some jeans on, nothing tight. Like, you get surgery, any surgery, I highly recommend to wear something loose fitting because of the discomfort. And also you want to get in and out of your clothes fast, go to the restroom comfortably, and also bleeding. You know, I'm very big on infection, so and bodily fluids. So I made sure that I wore something that I was very comfortable with, and also I wasn't worried about getting blood on, and, you know. So I had a sweatsuit set. There is gowns, like, you know, there's really cute gowns that you can purchase on Amazon or any type of retail store. I'm going down to the pharmacy. My mom was there. So you do need somebody with you that's going to be with you during your surgery. When you go and get your surgery done, there needs somebody to be there, to be in attendance, because you can't drive. You cannot drive. You're heavily sedated. You're in pain. All of those things. So there needs to be somebody there, present, after your procedure. So my mom is, you know, pretty much my emergency point of contact. So she was responsible to go get my medication from the pharmacy. My mom was helping me, of course. I get inside of the house. Now I want to take off all of my clothes that I have on that I wore to the hospital to put on my gown. I have a gown. And I had purchased Depends, which is like diapers. And I put all that stuff on. Like, my mom helped me. I put on the Depends, like, you know, change everything. Change my outdoor clothes, put the gown on. Now I'm putting on Depends, and the Depends absorb any blood and all of that. So I just want to make sure everything was sterile. And while I'm in the bed, I am in pain. Try to walk. Couldn't do it. try to go to the bathroom. I went to the bathroom. I could go pee, but it was hurting because, you know, it's open. So I have to use a peri-oral bottle. And what that is, pretty much like a water bottle, but for women. Women that have had babies, they usually tear. So a peri-oral bottle, or they're very irritated down there, a peri-oral bottle is ideal for that particular reason, to clean down there without rubbing. Because when you rub down there, especially if the skin's irritated, it's not nice. It's not nice. So I was using my peri-oral bottle when I would go to the restroom and like pat dry. All I can say is that I was pretty much out of it that whole week. I didn't have any type of appetite. I didn't have any appetite. I was just forcing myself to like eat, you know, small foods like soups, like fruits and like teas, because I'm big into health and wellness. So I wanted to like get on top of it. Like I wanted to heal. I want to heal very quickly. I don't like to be like down for too long. So in the mix of that, I am forcing myself, but not overeating, to make sure that I'm staying consistent to eat healthy and then make sure I get my body healthy. As well, I can start taking my vitamins now. My vitamins are supplements that are going to help with like the overall health of the body. So if you're getting surgery done, I highly recommend to get on vitamins prior to, so your body can immune that, and then start taking them afterwards when your physician says that you can start taking your, you know, your vitamins, just because you know, you're going through the healing phases and you don't know how everything's going. I didn't look down there for like a good 2 weeks. Like I looked, but I didn't put like a mirror down there and be like, hey, what's going on? So I did not know exactly how I was physically looking for about 2 weeks, and I did a follow-up with the doctor. Now we're 2 weeks in. I can get up and I can walk. It's a little sore. It's a little sore and achy. I end up talking to a physician, because usually when you get surgery 2 weeks afterwards, they want to talk to you on the phone to see how everything is going. So I end up talking to the physician on the phone in regards of my surgery and how I'm feeling, how I'm doing. So I'm doing good. I'm feeling good mentally. But I still was noticing, like when I go to the restroom, or like, when I go to the restroom and I'm using my peri-oral bottle, I'm burning. And I'm like, I shouldn't be burning. I should just be sore. So I end up looking down there and I see that it looks like one of the stitches busted. And that being said, since the stitches busted, it had like the skin was open a little bit. So I was like, I'm very, very concerned about that, because I don't want to get an infection. So I told the physician that, you know, they made me an emergency appointment because I just got my procedure done. So I'm considered a priority. So I get to the doctor. I think I talked to her like on probably, it was like a Monday when I talked to her. I get there. They scheduled me right away that Monday morning. I come in. She looks. She says that everything looks like it's healing correctly. Can you tell me exactly what you're feeling? I tell her, I show her, and she's like, okay, well, that skin eventually will come together, but what we can do, I can suture it. So I'm like, that means I gotta get stitched up again, and I'm awake. I'm awake. So I'm a little nervous because I'm like, oh my God. So she numbs me, and next thing you know, she's suturing me up. The numbing was the most painful, but suturing, I didn't feel it. So stitch up again. I'm asking her, you know, now since I got restitched again and it's been 2 weeks, how long is it gonna take? She's like, you know, 6 weeks. We really gotta wait for everything to dissolve. You're gonna have another follow-up appointment in the next like week and a half to 2 weeks. So we'll go from there and see how everything's going. So we're 2.5, 3 weeks in at this point, and I'm feeling okay, still a little sore, you know, especially as it just got restitched again. They always said that's like soreness, like it's gonna be there. for some time, especially down there. It's a lot of blood vessels. It's a lot going on. So it's going to take time. A lot of the ladies out there, if you say you get this done in the summertime, I got my surgery done in the summertime, and you know you want to go to pool parties, you want to get in jacuzzis, you want to go to like river rafting, any of those type of things, I highly recommend to do this, say fall or winter, if you know that you're going to be in those type of activities, because you cannot get in water for 4 to 6 weeks, about 6 weeks. You cannot use a tampon for 6 weeks. So if you know that you cannot discipline yourself, then you might want to wait, or you might not want to do this at all. Any surgery that you get, there's always going to be a healing and a recovery time. And also, just because somebody expresses to you that the healing and recovery time might be this time, might not be ideal, because of the nature of you are your own individual, you are your own person. It's going to be different for everybody. For me, I don't know. I'm still healing. I'm still sore. But I'm just letting it run its course. So that being said, this is 2.5, 3 weeks post-op surgery. And I'm feeling okay. Obviously, I'm just liking, you know, what I'm seeing. I feel much better. Like, I feel so much better. Like, it's amazing how you can do something to help with either, you know, just to change something, and not just to see it, but you can feel it. So when you can feel it, it makes you feel even more, and like it makes you more like confident. So this is something that most definitely did help with my confidence, but mainly just make me feel like I can just live my day without having to worry about, like, oh, this is irritating me. Oh, I can't wear this. You know, oh, I can't do that, you know? So yeah, labiaplasty for the ladies. If you have any questions, concerns, comments, or anything that you want me to discuss or address that I possibly missed, let me know in the comments below. I'm tuning out. That's all I gotta say. I'll probably do another post-op 6 weeks out. That'll be in another 4 weeks, so a month. How I'm doing. And if y'all want to see videos of me, like, you know, actually showing you guys what kind of post care I got, I can do that as well. If you guys want to actually see a video of me going to the doctor and, you know, just hearing what's going on, how everything's going on, I can do that as well. So thank you for watching. Subscribe, like, and comment below. Your girl is out. Thank you.